I really didn't expect myself to survive.
It really is the silent killer.
It is a conscious choice that you don't want to become sick.
You can truly take charge of it, but don't wait for the bomb to drop, which is what happened to me.
Heart disease is the #1 killer of women, but the good news is that heart disease is largely preventable just by living a healthy lifestyle. Our heart health is in our hands. To warn us about our #1 killer and inspire us to take action against it, the National Heart, Lung, and Blood Institute NHLBI created the Heart Truth, a national awareness campaign for women about heart disease. At community events and through local programming throughout the country, the campaign encourages us to know our risk factors for heart disease and make changes to achieve heart health for ourselves and our families. The centerpiece of the Heart Truth is the red dress, which was introduced by NHLBI as the national symbol for women and heart disease. The red dress is a red alert for women to take action and take care of their hearts at all ages. Each February during American Heart Month, the Heart Truth has celebrated the power of the red dress through National Wear Red Day and a partnership with the fashion industry where the red dress symbol comes to life on the runway at the Red Dress Collection fashion show.
We know that if women take care of their hearts and are aware of their risk, they can reduce their chances of developing coronary artery disease. Some of the risk factors that you can control are smoking, high blood pressure, high cholesterol, and high triglyceride levels, diabetes and prediabetes, being overweight or obese, being physically inactive, or having metabolic syndrome. The risk factors you can't control include having a family history of early heart disease, being over the age of 55, or having had a history of preeclampsia. It's also important that you know your numbers. We want women to discuss with their physician exactly what their cholesterol numbers are, their blood pressure readings, your body weight and your body mass index, as well as your glucose numbers and whether or not you're at risk or may have diabetes. So it's identifying your risk factors, having a personal conversation with your doctor about your personal risk for heart disease, and targeting where you want those numbers to move in order to reduce your risk for heart disease.
When I was 39 years old, I was exercising in a water aerobics class and began to cough, and turns out ended up at the hospital. They determined that I needed a cardiac catheterization, which revealed a 99% blockage. And the cardiologist said, "Erin, if you don't have surgery, you have less than a 1% chance of being here in 4 months." And I very quickly went under the bypass surgery and had the double bypass. I had a heart attack. I was in and out of the hospital at least a dozen times after my surgery. My life has changed dramatically. Physically, emotionally, spiritually, financially, it was a huge struggle for me and my family. Prior to the event, I would have told you that my health was relatively good. In the mid-'80s, when I got out of college, I was diagnosed with high cholesterol. About 6 months prior to the event, I had a couple episodes where my heart would just felt like it was quivering. When I think back, I also realized how incredibly fatigued I was. Women, as a whole, we tend to blow it off, and we also tend to make excuses. So part of it is just by educating ourselves, we're empowering ourselves. There's lots of websites out there, but hearttruth.gov has some phenomenal information to help women. Since the surgery, to stay healthy, every single day I exercise, I take my medicine, I eat right, and if need be, I go see my doctor. My children don't eat red meat. We only have skim milk. Butter is a thing of the past, and I try to reduce stress as much as possible. I'm very adamant that I exercise, and now I walk 2 miles every day just because I know I need to keep my heart healthy. My family's gotten more involved with that, so I'm hoping ultimately it's a huge life lesson for them.
Commonly, when people refer to heart disease, they're speaking of coronary artery disease or coronary heart disease, which is a process in which plaque builds up in the arteries of the heart, and particularly the arteries that supply the muscle of the heart. In a heart attack, an artery that supplies the blood to the heart has a buildup of plaque in the artery that ultimately can rupture and cause a blood clot to form in an area of the artery that could block the flow of the blood down to the heart muscle, and that would cause the heart muscle to die. If a woman's experiencing signs or symptoms of a heart attack, call 911. 911 is really what saves lives because a woman can receive treatment en route to the hospital.
My heart trouble started when I was pregnant with my youngest child. I had the symptoms of a heart attack, so they thought I was in labor pain and I had to deliver by C-section. And 5 days after that, I had the same symptoms, but this time it was a massive heart attack. It felt like I was having indigestion, I was sweating, I was throwing up, and then there was a little pain on my chest, but not really much. And then when I had the second heart attack, which was the massive heart attack, I had exactly the same symptoms. This time, the chest pain was like 10 elephants sitting on my chest, and it radiated on my left arm. I had jaw pain, I had back pain. The after effects of the heart attack is much worse than having a heart attack itself. You know, I was in deep depression, I was suicidal, I was in denial for a long time. I didn't know that being healthy would help me be back on track until I found the Hard Truth campaign. It's not easy to change your life dramatically or to live a healthy life. Where I was raised, the diet is high in fat and cholesterol. Most of the food are fried, and the meat that we eat are beef and pork. It takes a lot of willpower, determination, and support. It took me about a year to get to that system of having to exercise daily and eating healthy and doing away with sweet or processed foods. I really felt so proud of myself that, you know, I was able to achieve it.
Well, after what had happened to my mom, I became more aware of my risk factors because that's the number one thing that she had told me. I wanted to help people out, so I went into nursing to spread that message to other people too. I know I have a major risk factor, which is family history, but just because I have that risk factor, it doesn't mean that I have to get heart disease as well. So I'm working on other things like my diet and my health. I used to not go to the doctor every year, but after that had happened, I would always go to the doctor and make sure my blood work was okay. We cook together too. We're partners in crime and trying to get some more vegetables in our family side. So we try.
We're partners in crime.
There's so many things that I can change being only 24.
One of the risk factors is age. In being 65, I'm 10 years over the limit. That's why I try to make sure that I go to the doctor. I have a family history of heart disease. I like to be active as I am older, so I do walk every morning 2-3 miles, and in the evening with my husband. So that's very important to us. I do a lot of gardening as part of my exercise. My husband had some health issues, also cardiovascular issues, and then he got well, and then we decided we were going to travel and do the best we could while we were young and while we were mobile. Change comes from within. So I would say that you can do it. If I can do it, anybody can do it. It's a little bit of discipline.
I was 18 when I found out that I had high blood pressure. That was during my first pregnancy. I never really took it seriously until I almost died. So that was the start of things for us.
It's very important to know your family medical history. Our father had a heart attack. Our mom,
She does have high blood pressure
and diabetes. I've heard it before that Hispanic and African American women have a high rate of a heart disease. I was always in great shape. So, you tend to think just because you look a certain way on the outside that it's the same on the inside, and it's not necessarily the case. So, it was a wake-up call.
We are more conscious of the things we eat now. So we tend to eat a lot more salads and more fish and fruits. She is the motivator, so having her right across the hall from me makes it easier for me to get up and play Just Dance on the Wii, or pull out my typo tapes and go outside and maybe run around the park.
I think it's very important to establish a healthy lifestyle earlier, and it's very important for you to voice whatever health conditions you may have.
Heart health is important at all ages. Having just one risk factor can double your chance of developing heart disease. 2 risk factors can quadruple your risk, while having 3 or more risk factors increases your risk for heart disease more than 10-fold. Prevention is key. Here are some steps you can take to improve your heart health. Don't smoke, and if you do, quit. Aim for a healthy weight. Overweight and obesity cause many preventable deaths. Get moving. Try for 30 minutes of moderate intensity activity a day. Eat for heart health. Choose a diet low in saturated fat, trans fat, and cholesterol. Eat plenty of fruits, vegetables, whole grains, and fat-free or low-fat milk products. Know your numbers. Ask your doctor to check your blood pressure, cholesterol, and blood glucose. Work with your doctor to improve any numbers that are not normal. Know your family's medical history. Because the heart truth starts with you.
It's very possible to make a difference. Heart disease in and of itself is something that we know is preventable and can be treated, and we can reduce the recurrence of heart disease as well as the progression of risk factors.
It's never too early to change those risk factors. It's never too early to, control your life.
We have to be more conscious of the things that we do and the things that we eat and take care of ourselves.
The red dress, it clearly symbolizes women and heart disease. I mean, dress for women and the red for heart, love. So it's really very inspiring.
The red dress symbol means to me hope for myself and all women, so that we are aware of the disease and we can take steps to take charge of our heart health.